Most women never compare notes on their period, so normal just becomes whatever yours has always been. But some things you've written off as normal are actually signs worth paying attention to. Here are 6 signs your cycle might be telling you something, and what each one usually means.
Sign 1, cycles shorter than 21 days or longer than 35. A healthy menstrual cycle usually lasts between 21 and 35 days, counting from the first day of one period to the first day of the next. If your periods come less than 21 days apart, it's considered a short menstrual cycle. If they come more than 35 days apart, it's considered a long menstrual cycle. Occasional changes can happen because of stress, travel, illness, major weight changes, or intense exercise. But if your cycles are consistently shorter than 21 days or longer than 35 days, it may be a sign of an underlying health condition. Common causes include polycystic ovary syndrome, also known as PCOS, thyroid disorders, hormonal imbalances, high prolactin levels, or in some cases, the natural transition toward menopause. Irregular menstrual cycles can also affect ovulation, making it more difficult to predict fertile days or become pregnant. They may sometimes be accompanied by heavy bleeding, very light periods, severe menstrual cramps, or missed periods. Tracking your menstrual cycle with a calendar or period tracking app can help you notice patterns over time. If your cycles remain outside the normal 21 to 35 day range for 3 months or more, clinical evaluation is suggested.
Sign 2. Bleeding heavy enough to soak a pad or tampon every 1 to 2 hours. One of the most important warning signs of an abnormal period is bleeding that's heavy enough to soak through a pad or tampon every 1 to 2 hours for several hours in a row.
This is known as heavy menstrual bleeding, or menorrhagia, and it's not something you should ignore. Heavy periods can lead to iron deficiency and anemia, causing symptoms like fatigue, dizziness, shortness of breath, headaches, and weakness. Common causes include uterine fibroids, hormonal imbalances, adenomyosis, bleeding disorders, certain medications, or conditions such as PCOS. If you're passing large blood clots, needing to change menstrual products very frequently, or your period is interfering with your daily activities, it's important to seek medical evaluation. Identifying the cause early can help prevent complications and improve your overall reproductive health.
Sign 3. Periods lasting more than 7 days. A normal menstrual period usually lasts between 2 and 7 days.
If your bleeding continues for more than 7 days, it's considered a prolonged menstrual period and may be a sign of an underlying health condition. While an occasional longer period can happen due to stress, illness, or temporary hormonal changes, periods that regularly last longer than a week should not be ignored. Common causes include hormonal imbalances, polycystic ovary syndrome, PCOS, uterine fibroids, adenomyosis, thyroid disorders, endometrial polyps, or certain medications. Prolonged bleeding can increase your risk of iron deficiency anemia, leading to symptoms such as fatigue, weakness, dizziness, pale skin, and shortness of breath. If your periods consistently last more than 7 days, are very heavy, or interfere with your daily life, it's important to consult a healthcare professional. Sign number 4. Severe menstrual pain that stops you from going to school, work, or carrying out your normal daily activities is not considered a normal period symptom. While mild to moderate cramping is common during menstruation, pain that keeps you in bed, causes nausea or vomiting, makes you faint, or doesn't improve with over-the-counter pain medication, could be a sign of an underlying medical condition. Common causes include endometriosis, adenomyosis, uterine fibroids, pelvic inflammatory disease, or in some cases, ovarian cysts. This type of painful period, also known as severe menstrual cramps or dysmenorrhea, can have a major impact on your physical health, mental well-being, and quality of life. Many women suffer in silence, believing that extreme period pain is normal, but it shouldn't be ignored. Sign 5. Spotting between periods. Light bleeding or spotting between periods is another important sign that shouldn't be ignored. Spotting refers to small amounts of vaginal bleeding that happen outside of your normal menstrual cycle, while occasional spotting can occur due to ovulation, hormonal birth control, stress, or early pregnancy. Frequent or unexplained spotting may indicate an underlying health condition. Common causes include hormonal imbalances, polycystic ovary syndrome, PCOS, thyroid disorders, uterine fibroids, endometrial or cervical polyps, infections of the reproductive tract, or less commonly, precancerous or cancerous changes of the cervix or uterus. Spotting may appear as light pink, brown, or bright red blood and can last from a few hours to several days. If you experience spotting between periods repeatedly, after sex or after menopause, it's important to consult a healthcare professional for evaluation. Tracking when the spotting occurs, how long it lasts, and any associated symptoms can help identify the cause. Sign 6, cycle length changing significantly month to month. While it's normal for your menstrual cycle to vary slightly from month to month, significant changes in cycle length can be a sign that something isn't quite right. For example, if 1 month your period arrives after 24 days, the next after 40 days, and then after 28 days, this pattern may indicate an irregular menstrual cycle. Large fluctuations in cycle length are often caused by hormonal imbalances that affect ovulation. Common causes include polycystic ovary syndrome, or PCOS, thyroid disorders, high prolactin levels, excessive stress, rapid weight gain or weight loss, intense exercise, certain medications, or the transition into perimenopause. Irregular cycles can make it difficult to predict ovulation and may affect fertility in some women. They can also be accompanied by symptoms such as acne, unwanted facial hair, heavy periods, missed periods, or unusual bleeding. Your cycle is basically a monthly report card for your hormonal health. If something's felt off for a while, that's reason enough to bring it up, not something to just live with.